MST is a cycle breaker.
If you could just help one person change, then you can help 10 people change.
Sometimes parents might feel isolated in their experience that, why is their kid the only one that is doing this?
MST gives the opportunity for us to initiate the conversation. They just go right to it.
Hi, I'm Suzanne Kearns. I am a clinical psychologist, and for the past 8 years, I have been the network partner director for MST, which is Multisystemic Therapy. MST is a treatment delivery model that is for adolescents who are about ages 12 to 17 years old. And it's really for those teens who are struggling with their behaviors or substance use issues and are having struggles that might put them at risk for an out-of-home placement, like going to detention or incarceration or involved in the child welfare system. So it's really a treatment that's designed to help keep children at home and with their families, and to help parents or caregivers really learn how to effectively address the challenges that the young people are having. It's a short-term intervention. It's only 4 to 6 months long. You kind of are already thinking from the first time you meet a family how you're going to prepare them for you to exit out of their life and them to have an ongoing ability to manage all of the different challenges that any teenager brings to the table. What MST does is comes into the home and really works individually with each family to understand what is happening and what's going on. We call it an ecological model.
My name is Teresita M. Torona. I'm the founder of Four Feathers Counseling. MST is important in each community because it's multisystemic. It's focused on the 5 different systems that affect the health of that youth. You have the individual, your family, your peers, your community, and your school or /work. Each family has their own culture. The family actually can help them better than the system.
My name is Shandell Romero. I'm the MST supervisor at Health Solutions in Pueblo, Colorado. These are not bad parents or incapable parents. They just have experienced things in their lives or have never learned something different. So being able to offer hope and to offer the opportunity to raise their kids in a way that they really want to is really important.
It's a fantastic way of thinking. And it's also this attitude that's like, we will not quit, we will not give up, and we will see this family be successful. And you see that with the outcomes. My name is Jim Edgar. I am a director here of Youth and Family Services. I've been here for 10 years. We don't get too stuck on the statements. We start our cases by saying, well, what does the children need? Are the parents involved or not? We really want them to be learning skill sets to help them prepare for what's next. So it's not just whether or not, okay, they're in treatment or they're working with that clinician. They're also kind of bringing out, here's the future, and are you ready?
I think that's because our therapists walk in with that humanity, right? With that connection, with that willingness to be in the home. Maybe they're cooking dinner together with the family as they're doing their session, and they're just finding these ways to connect. We have a saying in MST, whatever it takes, and that our therapists really do whatever it takes to help support the families. MST has been around for over 30 years. MST is one of the most evidence-based treatments that we have. We now have over 600 teams across the globe, Canada and Chile and Europe and Australia. So it really is a global community of MST therapists that we see serving families. We have less than 5% of our families drop out of treatment.
For the year 2023, we had close to 200 families referred to the program. That speaks to stakeholders feeling confident in the program, feeling like we're able to help those families meet needs. And then this year, we're in May and we're already at almost 100 referrals for 2024. So the community sends us the referrals, they like what we're doing, they see the positive outcomes with families. So that would be 200 families that didn't have a service to be referred to if we didn't exist.
We are typically 85% or higher in our success rates. We don't want to be in your life and become a part of your family photo. We want to get in there, help you address whatever issues that you may be experiencing, and then let you go fish You go raise your family, not us. MST does the same thing. It is a very intensive, youth-focused program.
Parenting is one of the hardest and most rewarding jobs that we have in society.
What I love about MST is that there's a kind of an attitude that comes with it, which is a really healthy attitude. It's the idea of do whatever it takes and really try to reach out and connect. And at the times that we're so used to just saying we're going to give up on somebody, that's when MST kicks in, and they don't give up.
The best way that we help with families feeling comfortable and being open to having us in their homes is really taking the MST intervention of the one down. We're not there to judge their house. We're not there to judge what they're wearing. We are wanting them to have a happy, positive, functioning household.
If we can't do it, if we're not the best fit, we give it to other agencies. The cost benefit for us is improving the lives of the people that are brought to us, because they're going to go out in the community and they're going to be contributing to our community in a positive way.
We know that our young people that participate in this program are much more likely to graduate from high school. They're much less likely to be engaged in the criminal justice system as adults. They're more likely to have successful families themselves. For every dollar spent on MST, we're getting at least $3 or more in return on investment for this program. The life, what it means to not be incarcerated, what it means to get to live with your family during your teen years, what it means to have a good relationship with your parents in an ongoing way and have that support, I think is just so powerful.